Yeah, so I grew up in a little farm town in the Midwest. Two brothers, a little 7,000 person town, kind of blink and you miss it sort of thing. I knew growing up that I wanted to be some kind of doctor. I had an uncle who was a cardiothoracic surgeon. I think I have like early memories of just kind of seeing the sort of esteem with which he was held in our family and just being kind of fascinated with that line of work of like, you're helping people, he's saving people's lives, literally. So as I kind of grew up, got into early in my high school years, was starting to really seriously consider like career path type stuff and decided pretty firmly at that point I wanted to be a doctor. I was pretty open to a variety of doctor fields. I wasn't necessarily super sold on like chiropractic per se, but my sophomore year of high school I played football, so I got moved up to varsity and like just got beat up the whole year. So a lot of like just wear and tear stuff that I found really, really responded to chiropractic work. So I just like that really literally kept me on the field kind of thing. And so I think even earlier than kind of finally making the decision, I kind of gravitated towards liking that sort of work, really just from a pure like athletic performance standpoint. But my senior year of high school, I had a disc herniation in my neck. So football was like my passion. It was kind of the whole thing I did in high school. It was like my big thing. So herniated a disc 3 or 4 weeks into the season. So basically like season's going to be over kind of thing. I was at the emergency room because the herniation had pushed on a nerve in such a way that I was like, couldn't lift my arm kind of thing. So it was pretty gnarly one. And so I get cervical MRI at the emergency room. And of course, this is all medical minded stuff, but they basically tell you like, hey, just right out of the gate, football's done. We're over. My options are neck injection and or neck surgery is basically, kind of what they proposed to me there. And I had a huge like needle phobia. So I was like, no, not doing that. And then obviously surgery was like a pretty drastic move. So we decided to just kind of think on it. Meanwhile, had this couple year history of seeing this chiropractor pretty routinely, which I kind of went and saw what they had to say. And I mean, literally, I didn't even miss a game. I think I missed like 2 days of practice and probably shouldn't have been playing, but I was back on the field within a couple of days. Chiropractic just worked so fast for me. That's what like I had the first sense of not only is like, wow, this is super impactful. It's not just like little like aches and pains this can handle, but just big deal type stuff. And it was my first glimpse into seeing that like, oh, there's divergent paths when it comes to doctor opinions on things. Cut to, I decided to go to chiropractic school. So I did my bachelor's. I've always been kind of like, once I make up my mind, I want to go do the thing. So I did my bachelor's in 3 years. Just kind of plowed through it, took a bunch of like summer classes and stuff to just get it over with so I could get into the doctorate program. And yeah, so I was pretty traditional like chiropractic student going through that. I was really kind of falling in love with just chiropractic as sort of the philosophy, having had the one experience myself. And then in addition to that, just seeing, you kind of just tangentially hear other people's stories and get in that community of people in chiropractic school where you really start to understand sort of some of the depth of what can really be done through holistic health. During my path through chiropractic school, I took a special interest really in like corrective chiropractic care. Again, through kind of just a turn of fate, but my wife at the time was practicing as a massage therapist and got hired by a chiropractor who did a certain type of chiropractic called chiropractic biophysics, which is kind of like orthodontics for your spine. It has a lot to do with reshaping spines so that they function more optimally, but it's very data driven and objectifiable, measurable outcomes kind of thing. So I've always just been kind of drawn to that type of approach because it's really easy to say, well, here's your problem, it's measured. Here's your solution, it's measured. There's research to back it up. So I kind of like that as a general skeptic kind of person. So I started kind of going through that path. And then my last year of chiropractic school, I had really just my sights set on like chiropractic, physical body rehab kind of stuff. Functional medicine was something we learned enough to be competent, I think, in like reading labs, but there's not an enormous push, at least at that time, this is over a decade ago, but was not an enormous push for really integrating that in practice. I think a lot of chiropractors like learn something to pass tests and then you never use it. So it atrophies over time. But my last year of chiropractic school, my mom got diagnosed with cancer and unfortunately it was a very aggressive, just really tragic kind of thing, but it was about an 8-month course of diagnosis to passing away. It's emotional for me. But anyways, in walking through that with her, I really was not only devastated just personally from kind of watching somebody go through that, but as I then kind of learned further in school and even got into my career, really was devastated by the lack of care. Not caring, there was great doctors involved, but in 8 months of dealing with cancer, there wasn't a single conversation about diet on the front end. She didn't have annual blood tests that were comprehensive in any kind of way. She had a lot of long-standing GI issues and some hormone problems, and just stuff that was just kind of like, this is what I have, kind of thing. So it's a pretty typical story, but I just really committed personally to try to help people get away from that trajectory. And I think what's frustrating about, some of that experience, it's turned into positive for hundreds and hundreds of patients at this point that I've been able to impact. But what's frustrating is that you can see that stuff coming if you look. And, with the right interventions and the right kind of person in your corner. Just a lot of this stuff's avoidable or correctable if it's already kind of going the wrong directions. So I'm just really passionate about that, just from personal experience. And so I got into a place where I kind of early on, I went and pursued postdoctorate education in spinal biomechanics. So I have extra certifications in kind of like really advanced correction of spines. But, so what if they still have diabetes, or so what if that person still dies of a heart attack? So to me, it's kind of like, if not me, then who? Kind of a feeling about this stuff. So having experienced it, having been taught some of the things I've been taught and just had the experiences I've had, I just kind of feel like there is kind of like an honorable burden. I feel really honored to carry that, but I just think if we have the knowledge, the tests exist, the treatments exist, and your body's made to heal, it just seems like treating people in this sort of holistic way is really how it has to be. Yeah, so for me, it's really, I think my career has really kind of just been defined by trying to comprehensively evaluate people and just educate them. Sometimes I say just like what you don't know can hurt you, unfortunately. So yeah, I'm really passionate about treating the whole body and looking deeper than just the symptoms that are presenting. I can't tell you how many times we looked at people's x-rays and said, oh, okay, things aren't going the right direction. It's great that you don't have pain right now, but we can't count on that. So yeah, so that's kind of my philosophy and where I kind of came from on some of that stuff. And I'm in my 10th year now in treating people, and I don't know the numbers, but we've seen thousands of patients and had awesome outcomes. And the cool thing about holistic health is it's all really just allowing your body to express its health. The healing is within us. I just look like we're kind of getting in there and just getting other things out of the way, kind of letting the circumstances be optimal for you to heal. The healing comes from within. So in a sense, holistic treatment of patients, holistic health is almost easy as long as you look at the right things. It can be complex, but it's not hard. It's your body is trying to heal. The information in front of us that allows us to say, well, this is why you're not healing well, or this is why you're still having the symptoms, or this is why you're going to have symptoms. Changing your environment, changing your behaviors, it works, because your body's meant to be healthy. So carrying that sort of philosophy with me, I think, is just proven to be really effective. Well, in chiropractic school, it almost gets a bad rap sometimes for like how philosophical it is, because there's a lot. We had like 6 whole courses on philosophy, I think. But just as you kind of mature in your career, you realize like that dictates what you believe about somebody's capacity to heal, or whether or not to be hopeless. It affects everything you do. Every decision you make. So I think it's super important that you do have a strong philosophical kind of baseline for how you're approaching people. If I didn't think you were gonna get healthy, why would I bother testing? Why would I bother making the change? Why would I give up my Twinkies if there's not going to be a benefit? But the other thing I was going to say about that is, they teach above, down, inside out. The whole idea is like your genetics, your blueprints are right. Your body doesn't know how not to heal. It's a self-healing organism. So there really is, there's a concept in functional medicine called allostatic load, which I talk about a lot whenever I get a chance to kind of beat that drum with people, because it's not so much that we have to hit the nail even on the head with stuff. The more you test, typically the more you find. So we just need to gather enough information to say, well, like this stuff on this side of the seesaw is weighing you down. So let's just start moving rocks until we go the right way. So that's when I was kind of saying earlier that it's easy to do holistic health so long as you do the data collection. So long as we get the information, which is what's kind of frustrating about a lot of medicine is, me just giving you a Tylenol that takes care of 50 different aches and pains doesn't answer why you had them, and it leaves the door open for them to get worse, or for, what if that was an early sign of something else more serious? So we're just really obsessed with numbers and data, and let's see on paper what's going on here, because what we say is what gets measured gets managed. If we don't measure things, we're really just kind of swinging in the dark. Just having had the experiences I've had and seeing patients who come in with their stories, most of these people aren't like they just slept funny yesterday. It's 5 years of their life being affected, or I can't do this thing I love anymore. You'll hear from somebody later today. Pete is one of the last ones tonight. He's got a really, really powerful story. Just had this kind of 3, 4, 5 years of just, okay, I lost this because of my back pain, and then I lost this, and then I lost this, and I just caught him in the hallway the other day, and he was just saying one of the longest hike I think he's been on in like 5 or 6 years. So it's fun. When I spent, again, just kind of personal background with my mom's passing, but I spent a lot of years, I think I'm logically made the decision that I was like, okay, I'm gonna use this for good, be passionate, but emotionally I was just kind of, didn't really feel that way. No, emotionally for a long time, I just felt cheated. But talking about these things, it's kind of cathartic to even think about, but it's really true. So many people need help. Unfortunately, our system, the mainstream system, is not as helpful as it should be. It's helpful in the short term. It's fair, like if your house is on fire, okay, it's the fire department. But the amount of people we've been able to, open doors for and just really give them back things that they, I think, were maybe hopeful that could be restored, but not really confident of. Just a special thing to be a part of. Legitimately, in 10 years of practicing, it's been a single-digit number of times that somebody has brought laboratory testing in that I've actually said, okay, wow, this is comprehensive. And it's funny because I think at least focused on at least 2 times I can think of were the same lab that we work with. It just happened to be a different doctor's office that was running that stuff. One of my mentors, this guy Deed Harrison, he's like a hugely published researcher, chiropractor. He always says, in God we trust, everybody else bring data, and I just like that idea. And I'm not opposed to, especially in holistic health, there's a lot of stuff out there that's kind of like, well, like Reiki's a great one. It's like, well, it's not like randomized controls studies on this, but it seems to work or help, So I'm not opposed to things that are hard to explain, but we just know kind of this helps. But even allostatic load, you talked about that, is kind of, you can't measure it. It's a concept. It's an idea that, okay, well, there's a certain amount of burdening our body that eventually shows up as symptoms or disease states. But we know that working against that, or like that's the thing we need to treat. So I like also being in a holistic model because it does open, there's at least a little space reserved for kind of woo-woo, it's just like, there are some studies to validate some of that stuff. If somebody comes in hopeful about their outcome, the chances literally are better that they'll get better. Part of the passion we have for educating people is if you can hear a message and then say, oh, I didn't know that, maybe there is hope. And then, if there's an uptick in somebody's optimism, to at least make an effort or come through the door and see if they can be helped. It allows us to really just kind of begin this process of educating them. The amount of things that can be tested that aren't is baffling. It's like overwhelming how little we're looking at people and how big of assumptions we as a society are making about our own health based on that. I use an analogy a lot of times. If there's a bump in the night in our house, my wife is going to make me sweep the whole house. Like, I don't get to just peek my head out and say, I think everything's fine. It's like, I got to go check every room and turn the lights on. With our health, we can't just say, well, your 4 blood tests we ran all look good, so let's just assume everything else is good too. We just don't believe that. We believe that we need to check those things. If you don't turn the lights on, you can't see. And if you don't see it, you're not going to actually manage the problem. One of the most clear examples, very clear cut, is thyroid health, right? So TSH, thyroid stimulating hormone, everyone who sees this will, likely have access to through their doctor. Insurance covers it. They have no problem running that for you if you think you have a thyroid problem. But the questions that aren't asked about that are, well, what is TSH? TSH is not even a hormone from your thyroid. It comes from your pituitary gland. It's called thyroid stimulating hormone. So the only thing that actually measures is how hard is my brain telling my thyroid to work. There are 8+ additional markers that show how your thyroid is actually producing hormones, how bioavailable, like, are you actually using what's even being made? Is your immune system disrupting things in any way? So like our thyroid panel, our basic one is 9 markers, where I can tell you probably 60+% of people that we run thyroid tests on, their TSH is normal. And then they have disruptions elsewhere. And you can use that example. That kind of allegorically correlates with everything. I mean, like, inflammation's a good one. There's dozens of inflammation markers, literally, and some have direct risks for like near future, heart stuff even. So you can see a lot deeper than just these sort of cursory labs. Hormones is another great example. I ask people all the time, like, have you ever even had your hormones checked? And these people walking around with obvious hormone symptoms, the doctors often are working harder to convince them that there isn't a problem or that this is just what 40 feels like. They're working harder against the patient even gathering information, which is just wild to me. I had a medical doctor once call my office, this is a few years ago, and just chewed me out over the phone because I tested too many things. And the patient was concerned about their test results, which they had a lot of concerning results. And the doctor was, trying to lecture me on the phone because I scared their patient, by checking these things. I'm like, but there are actual problems. So the whole idea is just kind of wild to me that sometimes there's even pushback against looking deeper into things. In my personal experience, in my mom's health, some doctor could have said, hey, Diane, 5 years prior to her having cancer, things don't look good. We need to make changes. I mean, I would do anything. And most patients would do anything, and we just don't want people to come in when it's too late. We don't want to say, hey, 5 years ago, there was really a window of opportunity, and that's passed now. Because there is a limitation of matter. One of the principles we work with, is like, we're not getting anybody's finger to grow back if it gets cut off. Like, there's a limit to how much you can heal. It's incredible how much you can heal, but there is a limit. Getting in and getting things checked early and often is just the best policy. Again, it kind of goes back to that what gets measured gets managed thing. But if you don't know what your problem is, you got maybe a snowball's chance, so to speak, but there's not a big chance that you're going to fix the problem. If somebody had Lyme's disease and doesn't actually get tested to prove that, they just have a bunch of weird symptoms and then they think they're crazy. And then eventually their doctors are frustrated. So then they just get convinced they're crazy. And just, and you could name a lot of different conditions that kind of fall in that category of like, well, it's not a really clean cut thing, or conditions that just have sort of a false sense of safety associated with them. We have a lot of people who were like, oh yeah, somebody told me I had scoliosis 10 years ago, and there was no follow-up. And then we see, a nightmare when we look at their x-rays. Unfortunately, this society is just full of those stories. It's everywhere. And if you look at statistics, it's legitimately the majority of people are going to have some sort of health crisis in their life, mostly avoidable. That's where we're at. We want to stop that. Yes. Heart disease has to be the number one. Nobody should have heart disease. Literally, nobody should. Even if somebody's eating a standard diet that is maybe poor for them, you can see so many steps ahead on laboratory work that hey, things aren't looking good, or hey, things are really not looking good, or man, we got to change yesterday. You see this stuff literally years in advance. So you can say these dynamics shouldn't be at play, or hey, this number's starting to go up, and next this one is going to go up, and then after that we got problems. So that's very, very avoidable. Sometimes with certain genetic variations even. I had a patient who's a triathlete, exceptional shape. She's in her 50s at this point, and had been on high blood pressure medicine for 7 years, or 6 years maybe, but just a long time, and it didn't make sense because this person eats clean. And so we did a test, found out she has a genetic abnormality, which basically means that she doesn't do something called methylation well. Off of blood pressure medicine in a month, literally with just a couple of diet tweaks and a couple of vitamins that she was lacking in. Meanwhile, the longer you spend with high blood pressure, the harder and thicker your arteries get, which means we're barreling towards heart disease. Sometimes it's as simple as that. Other times it's more complicated, but heart disease is definitely number one. It's the number one killer in America, and it's shouldn't even be on the list. I think diabetes is another big one. Again, it's very reversible. A lot of times it can be reversed with diet, but something in the ballpark of 90% of people with pre-diabetes don't know they have pre-diabetes. And so again, it's just this kind of slow crawl towards a disease that if you see it early enough, you can make pretty easy changes to avoid that altogether. And then another one, I don't know if this is top of the list or not, but I think for me, one that I'm particularly passionate about is just degeneration in people's spines and in people's joints. It's very misunderstood as far as the general public has kind of been sold this narrative of it happens when you get older, you're going to degenerate. And people don't realize that's a dynamic response. Your body will restructure joints in response to pressure. And so if there's too much pressure on a joint, which can be measured we can do images and there's biomechanical assessments, we can measure this stuff and change it. But basically a joint's degenerating is actually just the bone trying to grow bigger because there's too much pressure on it. So it wants to increase its own surface area. So your body's trying to fix the problem itself. So in spinal degeneration, it's so common that the pain associated with the degeneration gets treated with injections, pain meds, whatever, but nothing's done about the fact that there's too much pressure there. So that's one thing that we do that's somewhat unique here, is that we really work a lot on reshaping people's spines to redistribute pressure. It's been shown definitively in literature, if you have a joint that's degenerating, you can see it before somebody feels it, but typically by years. And we know that process never stops, literally, until your spine fuses to itself, unless pressure is removed from the joint. So even when somebody goes and has surgery, if they're one of the lucky few who has a good result, they won't have a good result long term because the process still is ongoing. So that's one thing where we just can offer a unique permanent solution to. You can get somebody's spine to carry weight normally, which usually means reshaping it to an extent. You stop the degeneration in its tracks. It's been proven. A study came out last year that showed that long-term follow-ups. So just one thing that's I think 80% of the population has degeneration in their spine. Probably 0% should have it, and 100% of those with it could stop it from getting worse. So again, something I'm kind of passionate about, just because it's one of those that's just everybody's got it, but they don't need to, because it's been kind of talked about for a long time, but nobody's been able to have research to show. But there's certain electrical signaling that is what creates this feedback loop. So that's kind of really nerdy stuff. Basically, if you put too much pressure, there's thresholds in these different joint tissues. Basically, if you see a certain pressure threshold, it creates what's called a piezoelectric effect, but the physical pressure creates an electrical impulse that sends information that your body will then come back and start making more bone there. So that feedback loop can be broken.